Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to Ask the Patient Advocate podcast, where we discuss all things related to navigating your health. I am thrilled to have Kelsey Botti here today with me for this episode of Ask the Patient Advocate podcast. In the current age of healthcare, it is important to have an advocate to help navigate you and your loved ones through whatever challenges that you may have. And part of advocating is having the proper resources to support your diagnosis and management. Our episode today is focused on POTS, also known as Postural Orthostatic Tachycardia syndrome. Kelsey and I share the same mission to help people navigate their healthcare challenges. She is a physical therapist as well as was diagnosed herself with POTS back in 2021. After suffering from symptoms for over 10 years, she is now helping people with POTS with the POTS Life program. We will know more about it in just a few minutes. So, Kelsey, thanks for joining me. How are you doing today?
Good. Thanks for having me. I'm excited to share a little bit more about POTS and just happy to be here.
Awesome. Thank you. Well, I thought a good question to ask first is, can you tell our listeners and share a little bit about your journey with POTS and what led you to your diagnosis after years of symptoms?
Yes, so it was a long journey, like it is for a lot of people with POTS these days. When you hear different stories, most of them, it's multiple years before like a true diagnosis. But what happened for me is like you said, over 10 years ago in 2012, I was a senior in college and I was applying to PT school. Well, I guess by that point, I was already into PT school, going to start in the fall. I had a terrible concussion in like the beginning of 2012 that just honestly rocked my world and continued to for years, which I didn't know at the time how significant that would be. So I had a concussion. I live in Pittsburgh, so at the time it was super big. The Pittsburgh Penguins and Sidney Crosby, one of our star hockey players, had a concussion also. So it was, UPMC was on the forefront of concussion rehab. So I got to do all the things, vestibular therapy, like cervical, head and neck therapy with a physical therapist downtown. And, I really, from a concussion standpoint, got that part figured out. But as we went through like the next 10 years, I had all these symptoms that we could just never pinpoint. I would say to at the time we were just dating, but my, now husband, all these years later, I would just say, why? I just feel so sick. Now knowing it was POTS wrecks so many systems. It's like a multi-system effect through the whole body. So you'll hear people say from a GI perspective, I had colonoscopy, endoscopies. From a cardiac standpoint, I had unexplained ER trips with chest pain or rapid heartbeat, or, they would say, oh, you must be getting something over with a chest x-ray. It looks like you just got over a cold, or headaches, migraines. So you would see all these different physicians, and I just continued to get what I say now. I just felt like I was getting sicker and sicker and sicker. But there was nobody to really put the pieces together. Then I was pregnant with my first son in 2017, trouble getting pregnant, staying pregnant. And then I was always contracting. And they always said, you're dehydrated. And I'm like, I don't understand. I would go get fluids, things would improve. And then I had him. I wasn't great. Joint pain started. I just never felt myself. And then fast forward to July 2020, after I had my second child, that was like the final straw. Like that was like the second hit that just put my body in overdrive. And that was July after I had him. I would wake up, as you wake up with infants, you'd walk down the hall, I'd get to his crib and I'd be like reaching for the chair, like dropping to my knees, not knowing, but I was a busy mom with a new baby. I didn't think much of it. And so what I did is I pushed it off until after Christmas. And when PVCs, which is like an extra heartbeat, I could feel them in my chest. I thought, I really need to get this looked at. And by the following May, I had been ordered a tilt table, worked with cardiology, and it was positive. So in terms of getting to cardiology and getting a tilt, that was pretty quick. But the entire illness and working through all the multiple physicians, that was over 10 years.
Oh, wow. That's amazing. I have had so many clients in the recent years that have either had a diagnosis of POTS or at least suspected that they potentially had it and kind of worked through to get them officially diagnosed, or, they come in with all these symptoms, like you said, and it's like they haven't been pieced together. I started practicing about 16 years ago. And at that point, POTS wasn't like a very commonly known term. And even now it's not super well known, but I think it's starting to become a little bit more of a known term, and even in like in the healthcare system and the medical world, because more and more people are getting diagnosed with it, but there's still so many people that are undiagnosed. So I think that's such a great story that you shared, because I'm sure many listeners that can relate to some of those experiences that you discussed.
It is. It's frustrating as you're moving through all of these providers. I was in contact with one physician. He said, I think on average, it's like 3 or 4 physicians or disciplines that you move through, because from each standpoint, dysautonomia and POTS, it's hard to piece together. When you do piece it together, it makes sense, but you almost, in air quotes, you don't look bad enough in one specific discipline. So sometimes, or most times, I think it's just missed, and you're pushed on to the next specialty, and then you just keep going in this circle.
I like how you said that, because that's so true. You don't look bad enough in one specific discipline. And that's true, because, if you think about it, is it a cardiac disorder or is it a neurological disorder? Well, it's dysautonomia.
Mhm.
So that's already 2 different specialties, right? That could be involved, or you may be seeing for different symptoms. And then there's GI symptoms. There's
Mhm.
so many other symptoms. So
Mhm.
definitely it's very complex and multifactorial. And then I think too, one of the challenges is getting diagnosed, but then also too is like, once you're diagnosed, what's the best way to manage it? Because the treatment is
Right.
not one fit all treatment. So yes, I understand the struggle. I've heard it by many of my clients as well. Unfortunately. But tell us a little bit more. How has your experience as a physical therapist influenced your approach to managing POTS for both yourself and others?
So if you would have asked me pre-POTS diagnosis, I would have been honest and said, I don't know. Or I'm confident saying at this point of where I am that I would have been part of the therapist that probably pushed POTS patients too far. It's nobody's fault. It's just kind of like you said, in the medical community, it's people are hearing about it, but treating it, understanding it as a patient myself, feeling it, experiencing what those symptoms feel like, I just feel like 10 years ago, I would not have treated it the same. Now I know from how I felt myself and what my patients feel that it's not your typical no pain, no gain rehab. So 20-year-old female comes into the clinic. From the outside perspective, she looks great, right? She's a swimmer, she's fit. So why wouldn't she be able to do squats? Why wouldn't she be able to lift heavier weights? They do these things, and then these poor POTS patients are down and out, their heart rate spiking, and they get this ripple effect days later. But until you fully understand POTS and the mechanism, and not just looking at the person, but really figuring out what's going on inside, it changes an entire treatment plan. So now I can confidently say, hey, listen, less is more, and let people know about that. But early on when I was a new therapist, I wouldn't have known, because it is not your traditional no pain, no gain type fitness rehab.
That's so wonderful. I think, having you experienced it firsthand, you can offer so much to your clients because you've been in their shoes. That's amazing.
Mhm.
So can you tell me more about the POTS Life program and what is it? And then what inspired you to create it?
Yeah, so when I was sitting more on the patient side, I mean, I still am, right? And when I was first diagnosed and they said, okay, you have POTS, and I'm like, okay, great, we have a name, now what? And they said, spend time in each position when you're getting up, have salt, and drink water. And I said to the woman on the phone, I'm going to need more than that because I have two little boys. Like,
Yeah.
is there nothing else? And they didn't have anything else to offer at the time. So that led me to different physicians, and the Cleveland Clinic is the physicians that I see. And they are, very upfront that exercise and research is proving that the right structured exercise is the way to cure, treat, whatever word you want to put with it, POTS. That's the way to improve the symptoms and treat your body and retrain your body to uptake the blood the right way. So when I went through my program, I biked every single day. That is something that's difficult to adhere to because long term, that's hard. I was desperate, so it worked for me. But I also know that's not realistic for everybody. So as I started seeing POTS patients in the clinic, I developed my own program. So it's 3 days a week biking and 3 days a week strengthening. When I was first diagnosed, I was scouring the internet. There is no strength program in terms of not that when I say strength, I don't mean you need to go hit the gym and we're doing overhead, a barbell, nothing like that. There was nothing to complement. We know aerobic training retrains the body in the right way, but there was nothing to complement from a strength perspective. And we know that's just as important because you need to get that blood flow up. We need strong legs, strong core, strong arms, but it was missing. So being a therapist, that's the piece that I filled in. And the aerobic portion that I have created is different than, what you see out there on the Levine CHOP protocol or Cleveland Clinic. It's different intensities. It's something that is a much slower graded approach because from what I experience and what I'm seeing in clinic is, it's low and slow is the key. So I took what we were doing in clinic that I had created in clinic, and I know I'm not able to reach everybody, right? I'm only one person. So now I have put it on a platform that it's delivered directly to a client at home via their smartphone. They would never need to step foot in a gym. I use a ton of body weight, some little dumbbells, exercise bands. The only time if they would have to go to a gym is if they didn't have access to a recumbent bike at home, then they would have to go to the gym. But if you have a recumbent bike at home, it is a full POTS treatment plan, delivered right to your phone, no matter your location.
That's amazing. Such an amazing thing that you did and program that you created. When did you launch the POTS Life?
So I have been treating in my clinic for almost 3 years now, but the POTS Life is brand new. It was our new thing we launched at the end of March of this year. And the feedback has been great. We have people across the country because what's cool about this tool is it comes to you. So it's all videos recorded by me. It's a daily planner. So every day what you're supposed to do. And we have a nutritionist who works with us. So she's in there. You can take advantage of this. Every option it has, you can log meals and you can, we have a chat feature in there. So my goal of this was not to just make it this standalone app per se that, okay, you download it and then you're on your own. We know POTS is tricky, confusing. It's overwhelming to be diagnosed. I don't want you to have to do this alone. So there is a chat feature built into the app and you communicate with us. Hey guys, this doesn't feel right today. What do you think? Or, I've been ill for a week. What do you think about changing the program? So it's very customized to where you are, the symptoms you have, and throughout the entire program. We want to do it with you, not just you're on your own. And I don't want you to feel alone and struggle.
That's so important. I think a lot of times people do feel alone, especially when they're navigating a new and rare condition. So I think that's such a huge component of it because I think that's a fear of almost everyone that's going to try something new, especially when there's a lot of unknown already prior to getting to this point. So that's amazing. And is this something that they just download from like the App Store, or how would one get this?
So they would get it through our website, thepotslife.com, and it walks you through and you sign up, and then it prompts you to download the app and it'll walk you through everything. And then honestly, that day, the exercises are assigned and you kind of get rolling. Questions I get are, is this going to be too much? Because I get it. I've been on that seat or sitting on that side of the table where I'm fearful because I already feel terrible. How do you realistically think I'm going to go exercise and not feel worse? The thing I try to get across is I 100%, those are valid concerns, and it's scary and it is unknown. That's why it's just a month to month program. I never want POTS patients, because I was one, to feel trapped or unsure. I want it to work for them. And it is, I think once they get in there and they see it is very low and slow. Sometimes, you'll have athletes who I have an ultra marathon runner who was running and then, POTS hit. And so to her, this app was like, are we going to go this far backwards? And I always say there's a method to the madness. Like, we have to go back to go forward. So everybody is starting at this low and slow, because the minute we exercise too hard, we tap into that adrenaline and we are just, fueling that POTS fire. So the goal is to exercise way below that threshold to not make you feel worse.
That's amazing. I love it. I love it. Kind of going back and starting fresh and just taking it slow. I love that concept. That's wonderful. So, Kelsey, before we wrap up, I'm sure our listeners would love to know more about your work or how they can connect with you. Is there a way that they can get in touch with you, perhaps like on social media or website, etc.?
Yep. So they can go to obviously the website or Instagram or Facebook at the POTS Life on there, or they can even typing in and getting to our website, they'll take you, you can find our social media through there. I always say our email address is info@thepotslife.com. I'm an open book about POTS. So even if they don't feel like they're ready to be POTS Life clients, that's okay. Send questions, or, I feel like this is very overwhelming, and it doesn't matter if you're newly diagnosed, a year into diagnosis, or even down the road, if you just haven't found the right combo, I'm happy to help. So no question with this diagnosis is too dumb. Ask away. I'm happy to help in any way I can.
That's wonderful. Thank you so much, Kelsey, for sharing your incredible journey and all the work that you do through the POTS Life program. Your dedication is so great and so needed for so many people, and it's just truly inspiring. I really, really mean that. So to our listeners, remember that managing your health, especially with complex conditions like POTS, is a journey, and that it's better when you have the right support and resources available to you. If you or someone you know is dealing with POTS or similar challenges, I encourage you to explore the resources available and consider programs like the POTS Life. Thank you again for tuning in. If you are looking for a patient advocate or curious about how we can help, please give us a call at 947-517-8395. Till next time. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.